Hello, everyone. Hello, everyone. My name is Mariah Nichelle, and I work for NAMI Chicago. I'm extremely excited and humbled to be here today. And today we will be talking about mental health awareness. If you have any questions, feel free to put them in the chat or save them till the end, and we're more than happy to answer them for you. So, what will you be learning today? First and foremost, we're going to introduce you to NAMI Chicago, who we are, what we do, the resources we offer, and most importantly, our helpline. You will also learn how to understand and support your own mental health while also learning how to cope and support those with mental health as well. Today, we will describe concepts of wellness, individual self-care, and community care. We will also understand, like I said, how to support your own mental health as able to provide effective support as well. To begin, it is very important to understand your wellness is your own. You may be a parent, you may be a sibling, you may be a child, you may be a partner, but your wellness is your own. So I want you to think and feel free to share in the chat. What is the last thing you did for your own wellness? It can be physical, it can be spiritual, it can be emotional, but what is the last thing you did for your own wellness? This doesn't have to be expensive. This doesn't have to be big or small. It can be something such as taking a walk, which would be physical. It can be something spiritual like praying. It can be something emotional like allowing yourself to cry. But it's important to understand you should always be reflecting on what are you doing for your own wellness, okay? What do you need to do in order to feel your best? People around us should normalize mental health and provide mental support whenever needed. Someone walked around the National Harbor for 30 minutes on Monday. That's beautiful. And it can be as simple as taking a walk. It can be for extended periods of time. It can be for short periods of time. But it's important to understand wellness doesn't have to be expensive, and you don't have to go out of your way for your wellness either. So, NAMI Chicago, we are guided by the experiences of those living with mental health conditions. And most importantly, we are rooted in equity. We educate to fight stigma and discrimination. We fiercely advocate for our community. We share hope, connection, and expertise with people who are on their own mental health journeys. Our vision is a world that embraces and prioritizes mental health and mental illness. We are an advocacy organization. What we promise to do is to provide a good experience for people as they navigate the mental health system. Not only are we focused on the individual, but we are also focused on families and their communities. We are inclusive and we don't specifically focus on one specific diagnosis, such as schizophrenia or depression. We believe stigma is the number one barrier to mental health care. The work we do is to normalize mental health and address the barriers people are facing. At the end, hope is the very core of what we are doing here. So, what do we actually do? We have 6 different pillars of what we are doing. First and foremost, we connect thousands of people each year to mental health care. Part of that goes with our specific helpline, which can be seen on the screen. The number for the helpline is 833-626-4244, and the hours are listed here as well. We help callers meet their daily needs. We serve as a compassionate listening ear. We help in crisis response efforts, and we also partner with 311. Besides connection, we also offer support for anyone living with a mental health condition and also their families through different support groups that we offer. We do a lot of training through education. We train the community on mental health, crisis intervention, de-escalation, and a lot more. We are advocates for policy and change at the local, state, and even federal level. We assist individuals in residential facilities so that they can have the chance and opportunity to live independently. And lastly, but most importantly, inspire hope because we want everyone to understand healing is possible. So, this is our recovery model. At the very foundation of it, we have placed equity. Without equitable access to care, resources, and safety, feeling well is very difficult to maintain and to even achieve. This is true for the mental health system, and even more so when we think about wellness. This is the case for students as well. So, besides equity in our wellness recovery model, we begin with health. Health includes the quality, accessible mental health care, but it also includes physical health because we know that the mind and body are very connected. The next component would be home. We are going to further break these down in just a second, but having access to a safe, affordable place to live is very important for one's mental health. Home also includes living in a place where we feel both safe, supported, seen, heard within our relationships. To continue, there is purpose. When I talk about purpose, it doesn't mean that you need to know exactly what you want to be or exactly what you want to do, but it means you have activities and different hobbies or interests that bring meaning and hope to your own life. This might be being part of a team, having a club on the weekends, having a specific job, having a hobby that brings you joy. The last component is that of community. Community and connection build us up when we are down. NAMI recognizes the importance of having very healing relationships. This could be with friends, family, communities, peers at a school, or a faith community. But even having just one person in your life can change your life. If you are listening and you're worried that you may be feeling isolated, that is normal and that is okay. But it is important to know NAMI Chicago is a great resources, one of the great resources for you to use. So when we talk about health, now we are going to take a deep dive into each of our pieces of the wellness recovery model. First and foremost is health, quality, accessible mental health care, and physical health care. Okay. Health includes quality, accessible mental health care, but it also includes the physical health as we know that everything is connected. This, for example, could include your ability to play sports or spend time outside, and access to a balanced diet at all of your meals, and having ongoing access to a doctor for routine and necessary health care. There are many, many reasons people don't get help. One of that is the biggest one is stigma. Why aren't people getting help? The idea that people are lazy and weak-willed and won't seek help is not accurate. It feeds back into that stigma we just discussed. People have very bad experiences in their first experience with the mental health care system. Sometimes they tend to not go back. As many of us know, insurance can be restricted. Wait times for psychiatry or any type of mental health support can be a barrier. Stigma is the biggest barrier to care for. If you are ashamed or embarrassed or overwhelmed or confused because someone may call you a negative name, that's normal. How you feel when it comes to the healthcare system is valid. It is important to understand stigma is the problem. Today, we are here to try to end the stigma or at least reduce it when it comes to mental health care. The next one is home. Having access to a safe, affordable place is very important for one's mental health. Here in Chicago, we understand the cost of living can vary for different individuals, but we want to make sure that we understand home doesn't just mean a physical place. It can also be living in a place where we feel safe and living in a place where we feel supported by our relationships and our communities. The next one is purpose. Again, having activities and things that bring meaning and hope to your life. Purpose doesn't have to be just your job. Purpose doesn't have to be other people. Purpose is what you make of it. Purpose can be huge, such as my purpose is to do XYZ. Or you may be still on the journey to find your purpose, and that is okay too. Wherever you are in your journey is 100% normal and valid. Finding your purpose may take time, and that is okay as well. The next one is called community, like we talked about earlier. This is where connection builds us up when we are down. This could be with friends, family, at a school, or a faith community. It is important to understand NAMI Chicago recognizes the importance of having healing relationships. It doesn't have to look one way. It can be very different experiences and examples. And the last piece, back to the center of our wellness model, is that of equity rather than equality. Equity is the piece that ties all four of our components together. We, as NAMI Chicago, our mission is to exist to fight for changes to create an equitable mental health system to ensure that no matter who someone is or where they are located, mental health care is more affordable, accessible, and culturally responsive. With this recovery model, we have placed equity in the center. So at this point, you may be wondering, well, I want to have a better understanding of mental health. And there are three components in the mental health model. The first one is our emotional, psychological, and social well-being, how we think, feel, and act. And mental health also affects how one can handle stress, relate to others, and make choices. It's important to understand all of these exist on a spectrum. What is normal and usual for one person may not be the exact same for another. Mental wellness is the actual effort to maintain good mental health. So when we talked earlier, I asked, what's the last thing you did for your wellness? That is a part of what we are talking about here. We will all experience some sort of emotional distress from very different events in life. But it's important to understand our environments and our mental health exists on a spectrum and on a continuum for each and every single one of us. So again, mental health is composed of these three different components: our emotional, psychological, and social well-being, the way we feel, think, and act, and it can impact or affect how we handle stress, relate to others, and make choices. So for Black and Brown communities, this part is very important in the sense how Black adults are 20% more likely to report some serious psychological distress than white adults. The suicide rate among Black youth has been increasing faster than in any other racial or ethnic group. Only 1 in 3 Black adults in need of mental health treatment actually receive it. Okay? Between the years of 2015 and 2021, the data hasn't improved much. African Americans and Hispanic Americans use mental health services at half the rate of Caucasians. Asian Americans are at about 1/3 of that rate. The traditional response to the culture of individuals living with mental illnesses resort to religious leaders for assistance rather than mental health professionals. Some groups, some racial groups, actually fear the response society would give if their mental health condition was known. Okay? So it's important to understand over time, the facts and statistics have not gotten much better. All of this relates back to the word we keep bringing up: stigma. There is fear around getting help for mental health. There is fear for the wait time, the system itself. People are not having good time, having a good experience with the mental health space. But again, this is what we are trying to change. So, some mental health facts. Most people want to know about the facts when it comes to mental health. Mental health conditions are actually a lot more common than we may realize. 20% of Black adults report 20% more Black adults report psychological distress than white adults. 33% of Black adults in need of mental health treatment actually receive it. So, with these numbers, it is important to understand people need help. And that is what we are here to do, to educate, going back to our mission statement, and to hopefully end or reduce some of that stigma. It is important to understand that treatment is effective. And unfortunately, most people living with mental health conditions are not receiving treatment. Okay. More facts are 22% of Hispanic and Latino Americans have reported having a mental health condition, but only 36% of them receive mental health services. So again, more facts showing less than 50% of these demographics are actually getting help. Less than 25% for both are actually reporting the issue as well. This can lead to a lot of different reasons, such as the stigma around it, but it could be the lack of education or lack of literacy when it comes to mental health. We may not understand what mental health is, and we may not have the resources or tools for the next steps. So, why aren't people getting help? Think to yourself, why don't people get help? There's a lot of different reasons. There's no right or wrong answer here, but there are a lot of barriers to care. Most people with diagnosis are not receiving treatment in any given year. To be more specific, 60% of people with a diagnosis are not getting treatment. The idea that people are lazy and weak-willed and don't seek help is not accurate. There are a lot of reasons people don't get help, going back to stigma. But again, we've talked about there's a lot of fear. There's a lot of the unknown. There's a lot of, well, what happens if I talk about this? There's a lot of, well, if I talk about it, what do I do after that? And that is what we are continuing to discuss. More specifically, why aren't men getting help? Okay. Generally, men and women experience mental health conditions very differently. Okay. Women are more likely to experience internalized symptoms like depression and anxiety. At the same time, men tend to experience more externalized symptoms like aggression and violent outbursts, substance abuse and addiction, antisocial or oppositional defiant disorder, and attention deficit hyperactivity disorder or ADHD. Okay? Excuse me. With all of this, there's a lot of reasons men aren't getting help. Within society, there are different views upon men versus women versus other individuals and genders. It's important to understand it is not the same for two people. Two people may be very similar, they could even be twins. But it's important to understand everyone's experience is very, very different. Another example would be male-based depression can include increased fatigue, irritability, unwillingness to socialize, or anxiety about socializing, loss of interest in work or hobbies, and sleep disturbances. There's a lot of different warning signs. While some warning signs look similar, warning signs can look different for others. While someone may be fatigued, that may just be, I'm tired because of work. While another person is fatigued, it may be a bigger issue as well. Everyone's experience is one of their own. So when you start to see the warning signs, there's a few steps you can take, okay? The first one is to educate yourself and others on mental health topics, okay? The importance of education is in dispelling myths and misconceptions surrounding mental health conditions. Factual information about common mental health conditions and their prevalence help people understand and empathize. It's also okay to talk openly about mental health care and conditions. We don't have to be ashamed. We don't have to be scared. We don't have to be overwhelmed. It is okay to talk about mental health in the workplace. It is okay to talk about mental health within our families. It is okay to talk about mental health within our communities. Creating a safe space so people are comfortable sharing their experiences and seeking support is very, very valid and important. The next piece is to use intentional language. Utilize person first language and avoid stigmatizing terms when discussing mental health issues. It is very important to understand terms like crazy, insane, or calling the weather or a person bipolar can be very harmful. So instead of saying this person is depressed, or maybe saying my daughter is schizophrenic, instead we could switch it and say my daughter has schizophrenia, my daughter has depression, my daughter has ADHD. The smallest of changes in language can truly help fight the stigma when it comes to mental health. The next one is normalizing care seeking. It is important to challenge the notion that seeking help for mental health concerns is a sign of weakness. Getting help is braver than you think. Getting help is showing your strength and your power. There are many people who have benefited from seeking professional support and self care. While we have a lot of stigma within the mental health community and the mental health system, like we've talked about, mental wellness does not have to take a lot of money, does not have to take a lot of effort. As small an action as taking a walk, saying a prayer, spending extra 10 minutes sleeping, all of those are great first steps. Okay. Getting help can be a gradual process. You don't have to go above and beyond right away. If you are starting to see warning signs, it's just important that you notice them and get help to some extent. An example would be that of our helpline. That is a great first step in order to receive help. And the last one, avoiding self stigma. Show the same compassion to yourself as to someone that you love. Okay. If someone that you love is coming to you with a mental health concern or a struggle, you would show them compassion. You would show them care. You would show them patience and love. It is very important to do the same for yourself. It's also important to lead by example. It's okay to model inclusive and supportive behavior. Okay. It is okay to say, I've been through something similar, and show them what you have done to support yourself. By implementing these strategies, you and society can create a more inclusive and supportive environment and community. It is important to make people feel valued, seen, heard, respected, and empowered in order to prioritize their mental health and well-being. Earlier, I briefly mentioned the importance of language. Language is extremely powerful when it comes to mental health. Instead of saying something like, you're weak, you're crazy, a simple switch can be, that must be very hard to share. Thank you for sharing that with me. Thank you for opening up and giving them the space to continue to share how they feel. Another one that I hear commonly, suffers from, afflicted with, mentally ill. So that goes back to my example is, as she is schizophrenic. She has schizophrenia. she lives with schizophrenia, she experiences schizophrenia. Because someone may be living with schizophrenia, but they are not defined by their schizophrenia. Okay? Instead of saying nothing is wrong with me, you can say something as simple as, I'm not doing okay today. I'm not doing too hot, or I'm struggling a bit. It is okay to be vulnerable. It's okay to share how you feel. The next part is all about understanding your own mental health. Again, this may be the very first time that you're learning about what mental health is, and that is okay. But it's very important to understand if you want to help others, you can't pour from an empty cup. So, how can you do the internal work so you can be a model for someone next to you or someone in your life? So, some of the most common challenges are that of depression, PTSD, and anxiety. Okay. So, to begin, depression is the persistent feelings of sadness, hopelessness, and a lack of interest in pleasure in activities, especially during the holiday season. Some people know it as the holiday blues, the winter blues, and those are very common. The next one is PTSD. This is a result of exposure to traumatic events that cause distress, distressing memories, and anxiety. But you may be wondering, well, what exactly is anxiety? Anxiety is excessive worry or fear or nervousness, often accompanied by physical symptoms like restlessness or palpitations. So these are the top 3 challenges that people may experience when dealing with their mental health. We are not here to clinically diagnose, but we are here to express some of the warning signs that people may be going through. One tool that is extremely powerful is to know where you are at any given moment. Are you green? What are the signs that you are doing well? Are you yellow? What are the signs that you may need some support and you may be leaning towards red? Are you red? What are the signs that you are struggling? Using this tool can help you at any given moment check in with yourself, but also verbalize to other people how you are doing. It doesn't have to be long, it doesn't have to be challenging. A very quick check in with yourself can help you navigate how to move forward with your day or with your task. And before we end, it's important to understand, what does it look like? What does it take to be the best version of yourself? For some people, it takes every single one of these circles. For some people, it takes 1 or 2. But some of these circles include sleeping, eating, movement of some sort, mindfulness, intention, breath work, connection, creativity, and spirituality. You may be thinking, well, some of these sound very similar to each other, and that's 100% valid. To begin, sleep allows our bodies and mind to repair themselves and process information for the next day. Eating fuels our body for physical and mental activities. Reflecting, replace, and reinforce can help you when it comes to making healthier choices and challenges. Movement. Movement actually affects everything: your circulation, your digestion, your metabolism. If you feel better, then you'll start to think better too. When it comes to creativity, there is problem solving, productivity, and happiness. By tapping into your creativity, you can form even newer ideas to solve routine problems. Creative activity lets the mind loose and helps the mind to relax. There are a lot of different things that can make you feel your best. And remember, what works for you may not work for the person next to you, but what works for you is extremely powerful because you matter. Thank you, everyone. I would like to proceed with questions if there are any.
Great. Thank you for a great presentation. If you have any questions, if you could please put them in the chat or the Q&A. If you have any questions, if you please put them in the chat. We'll give everyone a few minutes. We're getting a lot of thank yous and amazing presentations.
Thank you all so much. Thank you for your time. Thank you for your patience. Thank you for your willingness to learn. I greatly appreciate it.
Great. The webinar is being recorded and it will be posted on youtube.com/Chicago BACP. There is one question. Are there any resources specifically for small business owners?
We don't have this resources specifically for that demographic, but we do offer our helpline, which is for anyone. In our helpline, they are trained to talk to just about anyone. So I think the helpline would probably be the best bet. Thank you for your question.
Excellent presentation, amazing information, just all around. Can you please add the link in the chat? I'm assuming they mean their YouTube, so let me do that. Any other questions? We'll give it another minute. They're asking if you have a direct contact email.
You can always email info@namichicago.org.
Perfect.
And they will direct it to me.
Perfect. Well, thank you, Mariah. We appreciate your time and this great information. Thank you, everyone, for attending and hoping everyone has a great night. Thank you all.
Thank you.